Hello, everyone, and welcome to the Pharmacy Guild of Australia's Virtual Student Summit. This is session 2, the Myth-Busting in Community Pharmacy Q&A panel, hosted by NAPS's very own Georgia Bridges. So thank you very much for being here, and over to you, Georgia.
Thank you, Annika, for that lovely introduction. So everyone says, I'm Georgia. I'm a current third year RMIT, and I sit as the RAPS president and the NAPSA treasurer. So thank you for joining us today. Welcome to today's webinar on myth-busting in community pharmacy. So the aim of this session is to shed some light on the myths and stigmas people might have regarding community pharmacy. Our panelists have a wealth of knowledge to share with you today through their own experiences and expertise, and are ready to answer all your burning questions. This event will be run in a Q&A format where students will be able to ask questions or raise any concerns they have regarding community pharmacy in the question box. So you should all see the Q&A function on your screen there. If you want to type in any questions, we can read them out to our panels. If you're feeling shy, don't worry as well. You have the option to ask anonymously. So I'll let our two panelists, Nick and Elise, introduce themselves, and then we'll get right into it.
You go first, Elise.
Thanks, Nick. Hi, everyone. I'm Elise Apolloni. I am a community pharmacist and credentialed diabetes educator. I'm an asthma educator and mental health first aid trainer here in the ACT. I am a pharmacy owner too. I started pharmacy ownership 2 years after I completed my intern year, so I'm tallying up to 9 years at the moment. And I'm currently a partner in 4 pharmacies, 2 community pharmacies in a metropolitan setting in the ACT and 2 in regional and rural New South Wales. Been a preceptor to over 20 pharmacists, which is always great fun, and it makes me very excited to see the future come through. My pharmacy that I mainly work at, Capital Chemist Waniasa, has won a number of Guild and Telstra business awards over the years. We have about 35 staff, about 30 health services, so quite a clinical style pharmacy. Also the ACT Vice President of the Pharmacy Guild. I'm on the Pharmacy Board of Australia and some Therapeutic Goods Administration committees too. And I have 2 little children, which are not here right now. So hopefully we'll get an interruption-free session from me.
Thanks, Elise. Nick Panayiaris here. I'm also a community pharmacist, have been one for, and this is where I'm going to be showing my age, 30 odd years. I started, I guess, I come from a rural background, did a Bachelor of Science and then a Bachelor of Pharmacy at Adelaide Uni. Then proceeded to work for quite a few years as a pharmacist and eventually fell into ownership. And I owned my first pharmacy in 1997. Some of you probably weren't born then, but anyway. Since then, I've pretty well done it all in terms of ownership. I've had multiple shares in pharmacies. I've played a significant professional service role in a group that had some 40 odd pharmacies, represented South Australia from a brand advisory point of view in terms of the Priceline brand. But in 2009 or whatever, was asked to take a role on the South Australian branch of the Pharmacy Guild. And I guess since then, yeah, one thing's led to another, where I have been on now 2 negotiating community pharmacy agreements, been on the team which has negotiated the last 2 agreements, was co-chair basically of the CP 2025 strategic project that we did at the Guild. One of the judges of Guild Pharmacy of the Year for the last 4 or 5 years, currently Senior Vice President nationally and also State President in our state at the moment. And also sit on as a trustee board member on our Guild superannuation company and Gold Cross. So yes, my journey has taken me from just, I guess, working as an employee for quite a few years right through to where I am today. So.
Amazing. Thank you, guys. As you can see, they're both very experienced. So any questions you all have, I'm sure they can answer it. So we've had a couple of questions coming, guys. I might start with the first one, which we've had, hi, Elise and Nick. Can I ask what attracted you to community pharmacy over other sectors?
Sure. Nick, do you want to go first this time?
I'll go first.
Lovely.
Look, mine was a really interesting, I love science, obviously, as you can tell, I did a Bachelor of Science and then did pharmacy after that. I guess at the end of science, I really love pharmacology. I majored in physiology and pharmacology, and I come from a small business background. So rural property, we had a fruit growing business basically for 40 odd years. And the blend of the two was always an attraction. It came to me at that point in time that said, well, look, how do I blend the love of what I do in small business and watching my dad over the years with my love of science? So pharmacy was just a natural fall in at that point of view. And yeah, that's how I fell into pharmacy from that point of view.
That's really interesting, Nick, and the farming background too. I am born and bred in Canberra. So not quite as exciting as Nick moving around and things, but I took a work experience placement when I was in year 10 at my local community pharmacy. I actually wanted to do it at the local video shop. Most of you wouldn't have been alive while those existed, but used to go and hire videos from a place, and I was like, that'd be a sweet high school job. But that didn't work out, and it was actually a blessing in disguise, because I went to my local community pharmacy as I had sort of raised that I might want to do medicine or something when I got to uni. And I had a great experience with a married couple who have not long ago retired, but they ran the pharmacy in like a family-friendly, warm fashion that I was really, I really enjoyed being part of that team. So then when I was tossing up between pharmacy and medicine in year 11 and 12, I thought, actually, no, I think pharmacy is a lot more family-friendly. I thought I didn't want to work overnight. I didn't want to necessarily deal with blood and excrement as much as I might have to in other settings. And I just loved how people respected and had a long-term relationship with their community pharmacist. And it was sort of that relationship that I fell in love with that led me to study in a rural uni. So I went to Wagga to study pharmacy. That pharmacy school doesn't exist anymore, unfortunately. And then when I finished my degree, it was pretty much, I was still in love with community pharmacy. I did all my placements, actually mostly in rural settings, and I went to the Northern Territory a number of times throughout my degree too, because I'm quite passionate about Aboriginal and Torres Strait Islander health as well. So, and I just, couldn't get enough of it, and then came back to Canberra and started my internship in 2 community pharmacies. So I split it to get sort of slightly different views, and then was offered ownership in my intern year. So I did a management role for 2 years with the prospect of ownership immediately after, which is what happened. And I just like how you're sort of part of, you've got a legacy, you've got a spot in the healthcare team for life. Everyone knows you because you're there for many, many years. Now I've been in this pharmacy that now I'm an owner at for 15 years. So people have seen me when I was little, when I used to be on the till all the time, and now they see me, dealing with their complex health issues and, being their diabetes educator on the side if they need health advice about that. They get their COVID vaccines from our pharmacy. It's just lovely to follow them through the good times, but also the tricky times, and know that you're sort of that trusted, forever constant in the healthcare system for them. So that's why I found it attractive.
I think I've definitely heard from quite a few pharmacists that not having to touch bodily fluids is a bonus of the job, as well as the nurture AM things. But that's really interesting how you are.
Yeah.
Recruited in your internship is quite cool. And I think pharmacy does provide a good blend between science and healthcare. It's a bit more chemistry based than some of the other degrees. We have another question here, which is, I picked a pharmacy degree thinking about community pharmacy, but I don't really hear my lecturers talk much about it at uni. Could you please shed some light onto why that could be?
Oh, I don't know why they don't tell you about it, because I think it's fantastic. There's obviously many different parts of the pharmacy sector. And to be honest, when I was at uni, it was probably a little bit similar. I was really lucky. I mean, if you haven't already got a part-time job or something while you're studying, go hit up your local community pharmacy and connect with them, because it's just, if nothing else, it gives you great pharmaceutical exposure to different drugs and things to understand and complement your studies. I think that helped my understanding at the time, but I already had a bit of a background. I think community pharmacy is sort of the unsung hero of the healthcare system, to be honest. We are always there. We always meet the challenge that falls in front of us. It is fun. It is different. I get paid to talk for a living, you know, and I get to build friendships with people and, you know, professional health relationships with them as well over many, many years. I mean, it's really lovely. I stand up, so I don't, all those risk factors associated with sitting down, I don't have in my life. It's been very family friendly and flexible when I've needed it to be, having 2 kids now. I just, yeah, I don't know why they don't tell you more about it. It's very clinical. I don't sell things that don't have evidence behind them. Our pharmacy has consultation rooms and private spaces and sinks and, you know, beds that people lay on in the consult rooms and all these things that you would probably see in a doctor's surgery. But that's not necessarily the impression that some of you may have from your occasional entries into community pharmacy. So go and have a look and see what it's like and, you know, expose yourself as much as you can.
Yeah, I look, just my response to that would be, I guess at uni, they're there to teach you, I guess, and there is that element of academia to some degree that sterilises, for a better word, you know, that discussion around career paths and so forth. And I know it's improving, and it's a lot better than what it was when I went through from that point of view, I can tell you that much, which was very just straight-based, you know, learning, and there wasn't much discussion around your career options and what they were. Look, as Elise said, I can't ever remember having a day in 30 years of practice which has ever been the same. Every day is a different day in terms of what's going to come across your desk. But the big thing I will say, and my transition over those many years, it's really about your choice of how you want to practice. You know, there's a lot of stereotyping around community pharmacy in what is seen from the outside, the optics of it, from that point of view, in terms of, well, that's how they practice every day. I can tell you, and especially since COVID, I mean, COVID's just been so good in so many ways to our profession, it's not funny. But it's really about, and that trend has started probably a good 5 to 10 years ago, but definitely now embedded in terms of the approaches and discussions I have with a lot of pharmacists from that point of view, but even in our own pharmacy. You can really choose how you want to practice. You can choose the breadth, you know, in terms of how clinical, like Elise said, you want to literally get involved in an everyday aspect, but the variety of the types of roles that you can play from day to day, week to week, and again, how you structure that within even your own development from that point of view is it's never boring. It's just exciting every day if you want to make it.
Yeah, and I think sometimes there's so much we have to learn in uni that they have to squish a small amount of knowledge into 4 years, but there are always other resources for students to access if they want to know more about community pharmacy. I think it's also a choice about how much you choose to look at while you're a student as well, and taking that step outside of uni. So we have another question here. It's a little bit more topical. Is it true that other pharmacists in hospitals and other positions get paid more than community pharmacists?
Well, I can say definitely not in the ACT, but I don't know about South Australia, so I'll let Nick go first, and then I can.
So look, not 10 minutes ago on my phone, I had a text from one of my branch committee members to another branch, well, to the membership basically of our committee. What are pharmacists being paid in your jurisdiction in terms of regional? And one of my members, who is in the southeast of South Australia, said 90 bucks an hour plus everything added. So accommodation, a car, superannuation, travel, a trip every month back to Adelaide, blah, blah. Just as one indication basically of this, and that was his one experience right at the moment. That's what he's had to pay to. Now in the city, and look, we just so you know, the Guild is currently doing a whole workforce survey around these issues to better understand, one, what the workforce challenges are, but also, you know, getting a true perspective of remuneration and roles basically accordingly. So Elise will probably articulate what's happening in Canberra, which is probably at the upper end to some degree, but I can tell you just from those initial workforce surveys that have come through, and South Australian branch has actually even got a payroll division, so we get a bit of data also from there. But the average pharmacy hourly rate, if I can call it that now, is anywhere between 40 and 60 on average. So that's an average, depending on your role and responsibilities at the end of the day, which is very much in line with what pharmacists are getting in the hospital system from that point of view, based again on responsibility from that point of view. So, and that's only just as a straight out rem, as in for your hourly rate from that point. That's not a negotiated rate that you might have depending on your location and how needy it might be and how good a pharmacist you are and so forth and so on. And obviously that excludes any remuneration you might get if you were an owner as well. So yeah, that's a whole different bucket of fish as well. So, but yeah, somewhere between those hourly rates is what the going rate is currently.
In the ACT, it's very similar. So in our pharmacies, we're usually looking $45 an hour plus, you know, it can go 20 or, you know, 10 or $20 above that easily, noting that that's the 9 to 5 rate. So our pharmacists, for example, get paid time and a quarter after 7 p.m. My pharmacy is open till 9. Weekends are more, public holidays are more, Sundays are more. I think it's moved a lot. So just as an indicator, I'm happy to lay it all out. So when I first registered as a pharmacist, I was paid $33 an hour. And as a manager, I was paid not much more than that as well for those couple of years. So it has moved quite quickly. And even in the last couple of years. Now, that's a good thing, to be honest. Even as an owner, we were always paying well above award for pharmacists. But I think the pandemic has, like Nick said, afforded opportunities to community pharmacy to help expand our contribution to the healthcare system. And that's meant that there are some areas that we've been able to enhance delivery, which in turn has meant we've had some new income streams for the pharmacy that we can then pass straight on to our team members. I'm very much about ethical and sustainable pharmacy ownership. So we don't take extra, you know, we don't pocket the profits, so to speak. We re-enter it back into the pharmacy to help grow it and to help make it better for our community and help keep our team happy. It's not all money. So, I mean, you know, not everything's about money, but money's a bit of it. And so you want to feel professionally and financially satisfied going to work every day. In terms of hospital, I actually have a number of friends that work in hospital pharmacy in the ACT and New South Wales, and our pay it exceeds what they would receive at the same sort of level of at each different level. So, for example, I'm not a hospital pharmacist, but my understanding is there's levels in the hospital system that you achieve, usually with a certain amount of study and professional exposure over a period of time. I feel that the pathway to higher wages in community pharmacy is faster, in that it's not necessarily tied to a particular form of study. It can be related to, you know, actual tasks or, you know, the contribution you make to your community. So it does give you a lot, and it's not a formula per se, in that you have the ability to talk about the pros and cons and how you feel you're contributing to a particular workplace, because they're individual and they're small businesses. Whereas when you're talking to sort of like a government, you know, predetermined, you know, set salary, you don't necessarily have any of that ability to discuss. It's like, well, you have this bit and that bit, so this is your rate. Whereas in a community pharmacy, someone can say to me, well, you know, I have these skills, this is what I can do, I want to learn about this, I want to grow like this, you know, how can we make this work for both of us? So yeah, I think I would be very, very confident to say, at least in every area of practice that I'm currently involved in, that community pharmacy definitely remunerates people as well as it possibly can, and continues to look to do so.
And I think the big question would be, obviously, we've all had enough of the COVID over the last 3 years, but looking at COVID and the workforce issues and the increase in wages, do you think this hourly wage is something we can see continuing going forward, that $40 to $60? Is it a stable figure, or is it something that's gone up from COVID and we can expect to see drop down?
It'll definitely keep going up, and I don't know how it works. Look, I'm not an economist or anything, but the value that the community places on community pharmacists is increasing too, and the representation in pharmacy is always looking for ways to make community pharmacies more integral in their communities, so that also helps. But once I put up a pharmacist wage, I can't then go back a few weeks later and say, oh, actually, I'm going to drop it now. That's not how it works. So it becomes the new minimum. So that's what we keep building off. So I think it's important to note that, you know, and for any of you were ever in a situation where that was happening, please talk to me or someone, you know, because that's not right. So it doesn't fluctuate, you know, with the season. It is what it is. So it becomes the new minimum, and we keep moving up from there.
Yeah, let me put it into a different way, which is around the stats more than anything else. Mm-hmm. Between the mapping at the moment in terms of workforce between now and 2030 is going to require roughly double, and I say double, the amount of pharmacists we've got in the system now. So from a supply and demand issue, unless we, bring a lot more pharmacists through the system, and from a Guild's perspective, we're working both with the union and the government in regards to, obviously, what can we do to start addressing the issue of real workforce issues, especially around the demand issue and the supply, basically, from that point of view. So, you know, for all new graduates, I would say, and it was to Elise's last little comment, let's just say the ball is in your court from here on for at least the next 7 years, based on the mapping required in terms of the services that will be delivered through generally community pharmacy, but pharmacy in general, whereby, you know, the award is just to reference the issue of the award. The award is a minimum standard. It is a safety net. It is nowhere near what the market conditions are based on, you know, what the demand for pharmacists is at the moment. So can a wage rate go backwards? Impossible, almost. I mean, especially in the current climate, we're not going to have the demand of what each community pharmacy needs, let alone the industry as a total. And look, just take a snapshot at the moment. As someone who's lived through 30 years of practice, it was rare to ever see a second pharmacist in a pharmacy, right? Even the biggest of pharmacies used to run with one pharmacist. It is rare today to see a pharmacy, and it's only due to workforce issues that you'll see a pharmacy with a single pharmacist. The average amount of pharmacists in a pharmacy, community pharmacy we're talking about these days, is 2 and a bit, and that's trending up to 3. So again, that demand issue, and then I'm not even overlaying those statistics with clearly the explosion that's occurred at the tertiary level of treatment in the hospitals, which, you know, a hospital pharmacy department used to have maybe 10, 15 pharmacists at one stage. We're now talking 200 to 300 pharmacists. So, you know, the demand for pharmacists in all sectors, because our scope basically goes across many areas of practice. We don't have a very, very narrow area of practice, basically. We have a very, very broad area of practice, and it's broadening. So, you know, we're not even talking yet prescribing. If you start prescribing, which will come into play in the next 5 to 7 years, that's going to create another level of demand for another breadth of scope of pharmacists, basically, which we're not even catering for at the moment. So what's the outlook like? Very optimistic if you're an employee, but you know, also quite challenging, but also very interesting, even if you're looking at it from an ownership aspect as well.
Thank you, guys. We might move in a slightly different route. I've got a question from, I think it's Nihal. I apologize if I get the name wrong. Nihal's asked for Elise. How did you learn into ownership right after internship? And how did you transition immediately from an intern to a manager? And what advice can you give to students to prepare for management into a leadership role?
So first things first, surround yourself with the right people. So for example, right now I'm advertising for interns for next year. I want 3, and I haven't found 3 that gel with me. So I want to find people that I can help on that journey if that's what they want, or if they want to be diabetes educators or whatever it is. So very passionate about partnering and finding those relationships. And so that's what I found in my intern year. I found one of those relationships. I'd been working in that pharmacy prior as well, so I had a bit of an idea that it was a good place to be. And now my business partner, Honor, was very supportive. And we had a connection in terms of, you know, a trust, and she saw that I was working really hard and offered me that opportunity. Our pharmacy group is a bit different to some in that you don't have to have any money to join ownership, because I don't have any money. So the idea is that we help young pharmacists come in early. That's when you're passionate. That's when you've got great ideas, and then that continues throughout your career. But it's good to harness that early on. It was not always easy. So I started my actual management role about 5 months after I finished my internship, and then I became an owner about 18 months after that. It was a bit rusty. I did some management qualifications that I don't think really did a whole lot more than just take up more of my spare time. You get things wrong, you manage situations suboptimally, you wish you'd done things a bit differently, but ultimately you learn from those mistakes and it helps you be better. In terms of preparation, it's mentoring, and it is, you know, finding a spot for yourself with someone that you admire and you respect and that's willing to invest in you, whether it be in their time to employ you, whatever it is, and build that relationship and suck them dry of knowledge. And I've been now able to afford some of my employee pharmacist ownership opportunities as well, from that relationship where I help them in another site. And that also makes me feel really, accomplished and helpful. So it's sort of a two-way street. It helps you, it helps them. So those connections are really important.
Yeah, well, there you go, guys. If you want an internship next year, hit up Elise. She got some jobs going.
3, not 50. 3.
Talking about this, we've got a question about intern year again. And what advice do you have for students thinking about intern year? Should we be looking at a large franchise or a more small community, traditional independent pharmacy?
Your choice, Nick.
Yeah, look, I've literally just had a chat with a student at the moment who we are lining up for our internship for next year, and I sat down with him and said, what do you want out of your internship for next year? What is it that, you know, and he's actually working with us, so he's obviously an employee at the moment. Very bright student. He could choose any internship he wants. He's probably in the top 10% of the class from that point of view. Lots of options. I've forced him to work in multiple areas of placement from that point of view, so he could get a good taste and perspective of the different types of opportunities from that point of view. And he's still come back and is happy to do an internship with us from that point of view. But I've actually just put it back on him, you know, on the basis of what do you want to get out of your internship? Because look, clearly the experience aspect of pretty well every internship, you're going to get the basics, you know, and you're going to have to meet all those basic requirements from that point of view. It's really about what more do you want, you know, from your internship, and that's how you gauge, I think, in terms of when you said, is it a franchise or is it, you know, an independent operator or small pharmacy? It's really about the areas, the type of practice you want to be involved in, and what do you want to get out of it, and can that owner actually deliver? And in many cases, not the owner, but the person who's going to be your preceptor can deliver on it from that point of view. So, you know, as Elise said before, you know, partnering with the right person is absolutely critical in terms of making sure you gel and you can feel like you're going to gel from that point of view. And I use that, you know, I quite often scare prospective interviewees for jobs because they can't work me out because I don't ask them anything about their qualifications, their marks, or anything like that. I actually just get them to talk to me and try and get inside their head to get to know them a bit more. And they can't work out, why is he asking me all these questions? The simple fact is, as Elise said before, I actually just, from my perspective, I don't really care if you've got credits distinctions or whatever, if you've passed and you maintain that minimum level, for me, it's about picking the right person that's going to gel into your practice, basically, at the end of the day. If you can't gel with me, then I can't work with you. And it's the same way with an intern. You really got to gel with that, who the hell your preceptor is going to be, and what are you going to get out of it from an owner's perspective. And look, with my intern right at the moment, he wanted everything. So he wanted to be involved from the business side of things. So he's going to be involved in all of the budget and business decisions, basically. He's going to be in the mix of it. He wanted to know about marketing, so he's going to be in the marketing side of things. He wanted to know about the stakeholder interdisciplinary stuff that one of my pharmacists gets involved with every week with the GPs and so forth. He wants to know about compounding. So we're literally going to put him through a rotation of as many of those facets in 1 year. And he's got the capability to probably do it. So it doesn't worry me from that point. But that's what he wanted. So that's the program we've developed for him.
It's all about that preceptor, that person. So worry less about the sign on the door and more about the human that is going to put everything into you to make sure that you get to that finish line in a very strong way, because it's a very big year, very stressful, and lots of milestones to reach. And you want someone that's experienced and who's committed to share that journey with you. You only get that one training year, because once you're ticked off, the expectations are all reset and it's different. So you want to be in a very nurturing and supportive environment, even if that means maybe it's not the pharmacy closest to you. It's more about, and often going a bit further afield makes it, more financially rewarding for you as well. So yeah, sometimes it's good to stretch your comfort zone a bit to get the right place.
Yeah, and I think you can start forming those relationships when you're a student. Like my boss at the moment where I work in a community pharmacy, he's incredible. Yeah. And we've already started talking about internships, so it's never too early to start putting your feelers out there.
Right. Yeah, it doesn't matter. Yeah, we have them we sort of have some in some years that we sort of work towards with as well. And yeah, pharmacies are often very happy to enter into those relationships.
Yeah, and I guess another question we've had here is, how has the I'll call it the yellow label pharmacy model, without naming anyone specific, affected independent pharmacy owners?
How does it affect? Pharmacy
how's
owners?
it affected? How has kind of the big branch corporation, I guess, affected independent pharmacy owners?
Look, I'll give you my own, and I've had many experiences, I guess, with the big box and any of the so-called discounters that pop in down the road from that point of view. And I know Elise is probably going to give you a very, because I've had to judge not only her pharmacy, but quite a few pharmacies in the ACT as former nominations of Guild Pharmacy of the Year, and they've done a great job in the ACT. But look, in terms of downtown Adelaide, Melbourne, Sydney, where the competition is as thick as thieves, and you are having to somehow differentiate yourself at the end of the day, and the risks that come with that, basically, when one of those big boxes lands right next to you. Look, it's all about your response and your preparation around that. And I judged the pharmacy a few years ago in Brisbane, which had one of the biggest yellow boxes I've ever seen. It was as big as a Bunnings, literally diagonally across the corner, right? So, and this pharmacy might as well have been living in a different world. Didn't give a rat's, basically, that they were across the road. Were completely focused on their own proposition and solution. At the end of the day, they completely remolded their business in terms of really being quite niche around everything from, they offered a 24-hour access. They did it in a really, really smart booth type way, which was very cost efficient. They were doing cannabis, basically, where across the road they wouldn't bother. They had a completely integrated service around alternative medicines and that whole integration, basically, in wellbeing. And so they differentiated their model completely from what was across the road. They didn't try and compete with them on probably 95% of their products. They didn't even bother, and they were growing at between 5 and 10% a year. And I can tell you the vibe from all their pharmacists and the people and all the staff that were working there was so positive and so energetic and so on and so on. So yes, if you sit there and you, either, it's the old adage, when you sit on the graph, basically, what are you at one end or the other? If you sit in the middle and you're trying to do a bit of both and you're not sure what your proposition is, then yes, you're in danger and you're probably going to suffer. But if you clearly differentiate yourself one way or another and don't sit there waiting and wondering whether things are going to be okay, but actually, proactively getting clear around what your proposition is. There's a lot of very sustainable, very lucrative, basically, pharmacies which are doing very, very well on that basis. So yeah, it's not the end of the world.
Yeah, that's in the ACT. We also have discounters, and in fact a discounter opened in the middle of within a kilometre and a half of both the pharmacies that I am now owner, which is what delayed my ownership by about 12 months at the time. Our philosophy has always been we're not like them. We don't want to be like them. And it answers another question a bit further down in terms of pay and things. I don't know what any other pharmacy per se pays because I'm only responsible for the ones that I'm involved in. But I can tell you right now that we don't have pharmacists moving from our pharmacies to discount models. They always come the other way and they don't look back. So that's sort of my general comment about that too. I think you just have to run your own race and you need to run it properly. If you want to be lazy, if you want to sit there and whinge at the world and and all the terrible horrible things that it's thrown in your direction, you can do that, or you can actually do something about it and you can be awesome and you can do everything you possibly can to service your community and be there for them, no matter how intricate and tricky and nuanced their needs are. Meet their needs. And that's the pharmacy that they're going to use. Now, of course, there will always be people who will have their needs met on price, and that's okay. But let me tell you, as soon as something gets a bit tricky, as soon as they want a professional, long consultation, or they want that more sustainable, elaborate service, they want that more that family feel about their experience, they will choose accordingly. And I want to be a pharmacy that is there and practicing in that way for a very long time, that gets that reputation so that people know where to go when they need that level of healthcare.
Yeah, and I think patients can definitely tell where the different pharmacies offer their niche services, and I think that's something you can definitely see. But I guess one thing, obviously you mentioned the question, Elise, is that do discount pharmacies offer cheaper prices by paying their pharmacists less? Is that how they offer the discount, I guess?
Yeah, and I don't know, but like I said, they don't move the other way. So whether, and again, it's not all about wage. There's also professional satisfaction. Like Nick said, working with lots of pharmacists, we usually have 5 pharmacists on every day in my medium-sized pharmacy. So the professional fulfillment you get with interacting with other pharmacists and seeing different ways of doing things, and working with the pharmacist that specializes in diabetes, but then working with the pharmacist that has a mental health interest, and kind of amalgamating all that knowledge. You can't, that can't necessarily be replicated in some of these other models where it's about keeping wages as low as possible so that you can maybe, sacrifice in other areas. I don't think that that's a sustainable way to run pharmacies. And, we want our pharmacies to be robust and have, great mentoring environments and be supportive and have the time to spend with people. I just don't really think it's a sustainable way of doing things.
Perfect. So thank you for that one. And I guess this is another one that's kind of a little bit different again. So I'm an older age student, very late 20s. Would that hinder me from getting a pharmacy assistant or internship opportunities? And if so, how do I overcome these hurdles?
No.
Like I was saying before, supply and demand at the moment. The age is not a factor.
No.
Trust me.
Yeah. One of my interns last year is actually the same age as me. And, with the added benefit of age, there can sometimes be different life experiences, maybe you've had other jobs before as well. Another pharmacist that I used to work with as an intern, she was a naturopath before she became a pharmacist. All these different things. Life experience also has a value. Age is not a problem. Don't even it's not even a factor. Just do life as you would, and you know, even if you ever got a vibe that it was, that's not the right place for you.
Yeah, go next door.
Yep. Someone else.
There's lots of jobs on offer at the moment. There's no lack of work and required pharmacists at the moment. You've got choice.
Yeah, that's right.
Exactly. And I guess, where do you see community pharmacy heading post the pandemic, as we're hopefully on the way out of the pandemic?
Sorry, say that again, Georgia.
I was going to say, where do you see community pharmacy heading post pandemic? Now we're on the end of it.
Oh, yeah. Well, and again, I'll give you my life experiences of being on council with the Guild before COVID and probably living through 2005 to, which was probably a fairly low point in so many regards, where generic substitution and the whole dumbing down, I guess, from that point of view, that era was probably, in terms of pharmacy as a profession recognition, one of the lower points that I've been through in my 30 years of practicing. But can I tell you right now, living through that and fighting through that, because I remember on council in 2015, sorry, it wasn't 2005, it was 2015, I should have said, where I remember telling Trent, we've got to take hold of putting, the value of what we do as a profession back into the profession from that point of view, in terms of its recognition. And I know we fought hard, and part of CP 2025 was to really start steering the profession back to its roots to some degree, which is what we used to do. And I'm not talking 10 years, 20 years ago, but 100 years ago, as pharmacists from that point of view. And then came COVID. And all of a sudden, as Elise said in, I think it was her opening remarks, the undervaluing of our profession and not being necessarily aware of what we do week in, week out, day in, day out with our patients, and the touch points we have, and the amount of, I'll call it influence, because it is in many cases through our education and so forth, and how we manage people's both health and medication from that point of view. All of a sudden, we were the most valuable piece of architecture and infrastructure, basically, in no two ways about it, because of the access we had to patients in so many ways. So all of a sudden, the alarm bells were going off in terms of, wow, you can do this, wow, you can do that, wow, you can help us with vaccinations, wow, can you mobilise and deal with medicine shortages? Can you put restrictions on this? Can you facilitate that? And we didn't say no to anything, because most of it was within our remit, and whatever wasn't within our remit, we are very good at adapting from that point of view. So where are we post-COVID now? In my personal view, and having lived through all of that and working at the highest level of advocacy that we can get in so many ways, we have never had a better time to absolutely embed that value, to really get back to the real recognition of what we do as a profession and how valuable we are in that continuum of people's health and disease state from that point of view, in terms of managing people's health overall. We've got the greatest opportunity in our hands right now, and we cannot let it go. And a lot of it actually is not only to people like Elise, probably not me, because I'll be probably long gone, but actually to everyone that's on this call. If you don't harness the opportunity right now and over the next 5 to 10 years to absolutely embed pharmacists and pharmacy, and especially community pharmacy, because that's what's out in the community, as a completely integral part and an essential part of the infrastructure to deliver health and health policy, we would have missed the best opportunity ever.
Yeah. We've risen to every challenge that there's been in the pandemic. We've learnt new skills in very short periods of time. We never say no, and we always dive and then work out how we're going to do it. We're building the plane while we're flying it, and I think that's a good thing. I think it shows resilience, it shows adaptability, and it shows a willingness not, you know, we're not going to whinge. We understand it's hard. We know, you know, there's some hard days, but okay, let's be part of the solution. Let's not be the problem. Let's not think of all the things and the barriers that exist. Let's actually just work out how we're going to get the job done. I feel like the relationship we have with the community now, I mean, I've always operated in a fairly clinical professional pharmacy setting anyway, so it's always felt like we make a good contribution to the health system. But I think, you know, more and more that connection that people feel to their community pharmacy has been amplified during COVID, because we were the only ones that they could actually come and see. So even when Canberra was in lockdown, you know, we were out in masks and shields on the street, you know, the pathway outside the pharmacy, you know, talking to patients. They couldn't see anyone else. They could only see us. And that's a really privileged position in the healthcare system. And, you know, no pressure, Nick, I'll do my best. We'll all do our best. But I think it is time. People have learned a lot more about what their pharmacy can do for them, purely because they've had to go into one. You know, not everyone needs to go into a pharmacy, but they're getting their COVID shot there, they're getting their flu shot there, they're, you know, getting their COVID-19 antivirals dispensed there and hopefully delivered. Hopefully they're not there in person at the time. You know, this is all happening in a community pharmacy setting, and we are just meeting all of their expectations. You know, we're delivering at short notice. We are offering them advice in the way and the method which they need, whether it's on the phone or in person. We're solving the problem of where they're going to get their COVID shots. I just think people are learning so much about pharmacy, and it's a really great opportunity for us.
Yeah, there was probably about 30% of people that would have never, in the last, previous to COVID, would have never visited a community pharmacy, never been in there.
Yeah.
And you know, it's not the regulars, as Elise said, it's not the regulars that we've been dealing with for many years. They know the value of what we do. But that 30% of the population that probably had never engaged with us or had any experience with us now has. And so that's a pretty broad section of the population now that has had a touch point with us. And, you know, to all the points that Elise just said in terms of the breadth and width, I was talking about this before, this is where our training and our scope of our competencies basically have come to the fore in terms of being able to adapt and deal with the width of what we've been asked to do. It's actually based on our training. We're previously working to such a narrow area of our scope in terms of training, whereas our ability to do a lot more, and that's going to be, to be honest with you, the challenge of the next 10 years. The biggest challenge we are going to face as a profession is the fact that we're going to be asked to do more, and our scope is going to get a lot wider. And it's about how we can manage to actually do what we still are doing. And we're going to have to adapt to that. And we're going to have to make changes to a lot of the tasks that we currently do and probably not do. I'll tell you that right now, and make sure that we can adapt to the new tasks that we're going to be asked to do. And that's going to have some tension around it. No two ways about it, but it's really, really exciting and optimistic from that point of view.
Yeah, I think it might have been you, Nick, who told me the story of the rats, the COVID concessional rats, and how they said they weren't going to go to community pharmacy. Then half an hour before the press conference, they called Trent and said, well, yes, we are, get it ready in a day. And that really shows the adaptability.
We delivered that now. That's a really good example. We delivered that in 2 weeks. There's no way any government department would have delivered that program in 2 weeks. The outcome, though, is more. We've delivered close to 60 million rats in 6 months, efficiently, without any hustle-bustle, basically no complaints, you know, very efficiently through a network basically that again, from a community's perspective, was easy to access, timely, you know, extended hours, any time of the day, whatever. No one's got that infrastructure or that ability to do so. And that's where they've seen the value of us now.
Perfect. Another question that's popped up is, do you have any advice for international students seeking internships in Australia?
Apply. Actually, one of my pharmacists at the moment is from Lebanon. So I think, yeah, you just have to apply. There was another question relating to internships as well, and like degrees and things. All that information is available on the Pharmacy Board of Australia website and the APC website, because it does depend on where you've studied in the world as to what the requirements are. But, you know, so there'll be, but yeah, apply, but make it explicitly clear what you're looking for and what you've already done, you know, and what has to happen for you to move into the pharmacy. I know some of the applications I occasionally receive, I get a bit muddled about, you know, have the exams been done? Like, where are we up to here? So just make it nice and clear. I think, like Nick was saying, you know, there is a demand at the moment, and it doesn't matter. It wouldn't matter in any situation anyway. I'm always looking to hire the best person for the job. So it shouldn't matter where you happen to be residing at a particular point in time as to whether or not you get that job.
If I can give you an anecdote of that one, but it's going back a while. My current business partner who's running my pharmacy at the moment was an international student who came here, literally had pretty well nothing in his pockets. I was offering an internship in rural South Australia, in regional South Australia. He borrowed someone's car and drove all the way 300 k's to come and see me. And at the end of that conversation, it was a matter of take a chance on me. I'll never let you down. That was 20 odd years ago, and we've been business partners for the last 12 years. And it was just, you know, as Elise said, just apply. Look, there are obviously requirements you're going to have to meet in terms of what you'll have to qualify and pass from an assessment aspect. But there is such a demand at the moment that if your heart's in it and you really want to basically make it work, there's a lot of people that are basically very receptive to work with any student from that point of view, let alone international candidates as well.
Perfect. And we all know community pharmacy, as you mentioned, is a bit of a pressure cooker at the moment with everything that's going on. Do you have any tips for how to perform under pressure when it may become very busy in these pharmacies?
I think resourcing is important. So, I mean, we've been getting progressively busier. We're going to automate in the new year. So we will have a dispensing robot by February. So that will help us. But, you know, I think it's important that workloads are safe and that you are adequately resourced to perform the tasks that you've got. There's often a lot of competing priorities right now. There's vaccinations, there's just the normal everyday stuff of the community pharmacy. There's the normal services that you offer as well, potentially like leave certificates or, you know, blood pressure checks or meds checks or whatever it may be. I think it's important to have the right people at the right time doing the right things. Obviously, there's times when that, you know, people get COVID, people, staff get COVID too. Things happen unexpectedly, but I think it's about taking a deep breath, working out what needs to be done now, what can wait. A lot of tasks that we think are urgent, when you actually look at them, they're not urgent. And setting expectations. I tell if someone hands in a prescription and I honestly know in my heart of hearts it is going to take longer than, you know, our normal 10-minute preferred amount of time, I'll tell them and say, look, it's really busy today. We do have a couple of people off sick. It is going to take about 15 to 20 minutes, and that does make it, you know, about 11 a.m. or whatever it is. I do find people need a time slot sometimes because they don't necessarily perceive how far that time is in the distance. So staggering your workload where you can too. But if you feel like it's an ongoing problem and it's a problem that's not resolving, making sure that you talk to the people that are in charge or managing the pharmacy and just explaining your concerns, because safety is really important and quality care is really important. And sometimes people may not be aware of how you're feeling. So do talk up if it's an ongoing issue.
Yeah, look, Elise has covered the main ones I was going to mention. We've all worked in stupid, chaotic environments. Some of the environments I've worked in just go beyond belief, basically, but they should only be very rare. If they become regular, then you cannot continue working. But the three things that I always used to, well, I learned through one way or another was breathe. I'm glad Elise mentioned that one. It seriously is one of the best things you have to remember when you are under the pump. Just slow down and actually start breathing and focusing on what you're doing in front of you. Prioritizing is really, really important. As Elise said, not everything is a priority, and you've got to quickly assess what is a priority and what is not. And that includes everything from, is a script waiting or is it not? And if you are doing scripts which are not waiting, well, clearly they're not priority right now, so you need to restructure. So taking that time to just stop, breathe and assess the situation is really, really important to stay on top of chaotic type environments. And the last one, which again, Elise did mention, the earlier you communicate to people, the earlier you'll manage the situation. If you do not say anything and they've got no idea what's happening out the back there or out the front there, wherever it might be, then clearly the pressure's going to keep building out there. Whereas you communicate early and then just manage what's in front of you, you will get through it basically step by step, and you get much better at doing that, after a period of time as well.
I think the one tip my pharmacist taught me was to always have a water bottle there, so make sure you actually drink some water during the day so you're not dehydrated by the end of it. One of the students has asked, it's really hard for me to find a job in the community pharmacy. Can someone give me some suggestions?
I don't know why that would be, but I think potentially going in person or introducing yourself, making sure that your resume is clear, that it's getting to the right person. Sometimes you send an email. I get so many emails every day now at the pharmacy with all the scripts and things and, tokens and things that are coming through, information. So I suppose just, go in, say hi, tell them what you're looking for, pop it into a few different places if that's an option. I think, again, in these times, pharmacies, I'm always very happy to have more pharmacy students in my team because they're interested, they're engaged, they've got a stake in the profession, they want to be there. They might not be with me forever, but they want to be, in the proximity of pharmacy. So I think hopefully, just maybe being a bit more sort of visible will help in these busy times, perhaps.
Yeah, I couldn't say any more apart from the face-to-face is really, really important. Don't wait for it to come to you. If you are not getting responses from that point of view, you've got to get in there. That hasn't changed in 30 years I've been practicing from that point of view. As I said before, the demand is there. It's just that we're also in a chaotic situation in terms of many workplaces at the moment actually don't have time to look at CVs just out of the blue and so forth and so on. So you've got to persist. If there's a particular area you want to go and work in, if it's either due to locality or a specific pharmacy that you say, look, I really would love a job there, offer your services in terms of some work experience. Put your best foot forward when you get that chance, but you've actually got to persist sometimes if it's something you actually want, or if it's just a general job that you want. Well, look, keep knocking on doors, and it's a lot of the time, I can tell you, it's all about timing. So you walk in today and you talk to the one person and yes, you don't get reception. You walk in tomorrow, you're probably talking to the owner who absolutely needs another person, and all of a sudden, when can you start?
Yeah.
And I guess that's kind of answers the question. It says, is it okay in Australia to go up to local pharmacists and ask if there are job opportunities? I think we've all been out with our resume on the street handing it out.
It's a bit scary, but what's the worst that they can say? They'll say, not at the moment. And you'll be like, okay, it's fine. No one's going to bite.
And I guess that leads into the question, is it true that you have to be an extrovert or a people person to be in community pharmacy?
Ooh.
You first, Nick. I have a very strong view about this one.
Well, you go first then. Go on.
Yes, you do have to like people to be in community pharmacy, because people are what we do. We are helping people. So I have over the years come across some people that really don't like people, and it's not nice. And to get the most out of the role for you as a health professional, and to have those interactive, those clinical, those robust conversations, it's so important that that you have that connection with people, that you build rapport with them. That's how you get the best outcomes in their healthcare, and that's how you feel most fulfilled as a health professional. Now, you don't necessarily have to be an extrovert, because I think quiet people can like people and have very profound conversations. My business partner, Honor, would probably be considered an introvert. Whenever we had to do a speech or something in the Pharmacy Guild Awards and things, she was like in the corner, and I'm like, yes, this is great. So different personalities. And that's good. That's a variety is a good thing, because different people warm to different personalities. So some people that you know, gravitate to me at the pharmacy, you know, prefer my style, but then there's other people that would far prefer Honor and her less, you know, her more demure approach. So I think that's a benefit, but you don't, yeah, but I think liking people is really important. But it wouldn't necessarily matter if it was community. You know, if you're in a hospital, you know, you're still helping people. You know, everything comes back to people, because that's why we're here.
Yeah, look, just from a personal point of view, I wasn't very confident. I was very shy, and I know it might not sound that way at the moment, but I've had to come out of my shell in so many ways. But I was, you know, almost scared basically to get out there in one stage or another, in terms of obviously really engaging and interacting. I mean, I loved the profession, and I've always had good dealings in terms of, obviously, like I said, even from a young background, just watching even my own father in terms of his business dealings from that point of view. And again, that was all about communication and dealing with people. But it took a long time even for me to get to a real confidence level. But as soon as I genuinely started feeling comfortable enough to just open up discussions and so forth and so on, then the rest I loved it, from the point of view that because you genuinely can actually make a difference with people's lives. So the more you engage, the more you get from them, the more change you can make. But look, one of our pharmacists, when he started a couple of years ago, we couldn't get boo out of him. Like he was really, really introverted, and you know, as much as we encouraged him, and our pharmacy, you can't hide. So there's nowhere for you to hide, basically, in terms of how you practice. But you look at him today, and he's just amazing. Like, in terms of, he just needed the right environment, the right support, and the right coaching, I guess, at the right time, to just give him enough confidence to say, well, you know, you can do this. And like, you watch Will today, basically, and the way he practices and the way he talks to people, you think, it can't be the same guy that we had 2 years ago. So you have to love people. That goes without saying, but I don't think you have to be an extrovert. Absolutely not.
Yeah, and I think you can learn these skills. I remember my first speech in year 11, I threw up in front of the entire primary school. So it's definitely something you can learn. And I guess based on talking to people and stuff, a lot of people say that being an owner takes you away from the clinical aspect of pharmacy and the day-to-day people interaction, I guess, because you're too busy. Do you think this is true?
You first, Nick.
Look, I've been through all the phases of being a single operator, where everything stops with you in terms of the business itself, and you're still doing 60, 70 hours a week on the floor, which is extremely challenging, like in terms of, you know, trying to get any balance, let alone then adding in family, and what happens then, or having a life outside of that. So yeah, look, it comes with its challenges. What I can say is, you've got to put good systems in place. The big learning over 20 years of ownership now is, if your systems are good, and I know Elise is probably some of the best that I've ever seen. If your systems are good, you've got the right people, you're a good delegator, and you've got good structure in terms of how your processes and stuff are administered, from both the business aspect, but also what happens on the floor in terms of your practice and how you work. I don't do as much as I used to, obviously, anymore. Back on floor, I probably spend a day or two at the moment at most, and even then, some of it's just managing, you know, people, as in my people, as in staff, HR, and looking at more the business operations, and still doing. But I love getting back on the floor. I love talking to people, you know, even if it is just giving out some paracetamol or talking to them about a specific condition. So you almost come a full circle to some degree, in terms of from start of ownership back to, you know, practicing and really, really back enjoying it from that point of view, once you get your balance right.
I'm part of a pharmacy group where our head office, our whole philosophy is around letting pharmacists be pharmacists. And I didn't go to uni to be a business person. I've had to learn some of those skills, but I principally wanted to be a pharmacist. So how it works is a lot of the stuff that potentially in more independent pharmacy situations that you may fall on you falls to our head office. So things like payroll, like buying deals and things, that's that's not my passion. My passion is helping the people in front of me. So I would say probably in a day, probably about 10 to 20% of my time is spent doing admin, but I'd say every pharmacist, irrespective of owning or not, has a proportion of admin. I've actually found that since I've become an owner, it's freed up my ability to really work out what areas of the pharmacy need more attention. And so that's how I studied diabetes education, and that's how I specialised in mental health and things, because that was important to the pharmacy and to me personally to deliver that offering to the community. So I think I've actually become more clinical. I'm currently undertaking accreditation for HMRs and things. So I think that's important. I suppose you have more of a ability to choose how you want that process to look if you are an owner. But of course, there are situations where it would be very difficult to have it all. But yeah, in my situation, I actually feel more clinical as time goes on. And I think because the public has seen me there for so long now, there's sort of like an assumption of experience level as well. And they know my name, they want to speak to me specifically. So I feel that to meet their needs in a more complex fashion, I constantly need to be upskilling myself to support their health the best way I can.
Oh, amazing. It's great to hear there's lots of opportunities out there, and HMR sounds really awesome. So someone's asked that they've heard that you get a wider range of exposure to clinical issues in true primary healthcare and rural pharmacies. Would you agree? What do you think the main difference in the variety of opportunities is by location?
Well, Nick, you've practiced you're probably better.
Yeah, look, I'll keep singing this tune until I stop practicing at the end of the day. And I probably told you, Georgia, the best thing you can do within your first 5 years of practice is get out to the bush, get out regionally somewhere. Look, I know I was born and bred there, and it probably was natural that I was possibly going to go back there, and I did, and I practiced for about 6-7 years in a pharmacy that I owned in the country. But in terms of and the reason I say that it's great from an early learning aspect, in terms of developing not only your skills but your confidence from that point of view, you've got nowhere to hide in the country, sometimes it's better now than what it used to be, because now there's a lot more, as Elise said before, collaborative work around having more than one pharmacist in many cases, whereas back then you're literally on your own. So you were stuck basically making a lot of decisions, and not, and that's why mentoring, I'll go quickly to the mentoring aspect. This is why in the first 3 or 4 or 5 years of practicing, if you can form a relationship, a good working relationship with someone who has had a bit more experience, and has got the experience of and breadth of working, just ask them if they don't mind you being able to call them no matter where you're practicing. That's the one thing I thank God I did early on in my career. I had a couple of mentors along the way who I used to always leverage in a difficult moment. So it could have been I couldn't read the script, or I needed to make a decision about something and I maybe didn't have all of the experience around how to manage a particular incident or whatever. And I'd pick up the phone, ring them and say, look, can you help me out? What's your advice on this issue? And I can't remember how many times that saved my bacon, basically, in regards to just giving me some confidence that 9 times out of 10, the decision I was going to make was correct. But just getting that reaffirmation is really important. But in terms of practicing in the country, you do expose yourself and have the opportunity not only to expose yourself to a wider range of scenarios, incidents, people, cultures, conditions, and so forth and so on, where they all are, can I say, you become a lot more close and intimate with all of those aspects, and you can play a larger role. but also from a local interdisciplinary type aspect, you are much closer with your GPs, doctors, physios, and everyone else in that local community. You do get a lot of intercollaboration where you are referring to each other and so forth. So it takes on a much more personal aspect to the way you practice, and it's so rewarding at the end of the day in terms of obviously the differences you can make from a health perspective. You leave that environment, and 9 times out of 10, the people that I've spoken to, young people who've done that and then come back to the city, nothing's a problem. Like it's like everything is, oh, this is easy. There's a whole different level of confidence in the way you practice in terms of the challenges you just find it a lot easier to practice, and also can contribute a lot more because of the experience you've had. So I highly encourage, if you have an opportunity in the first 5 years of practice, whether it be your intern year or any other year thereafter, especially before you probably make decisions about settling down in bits and pieces, and you're probably a lot more independent, just go for it.
There's often blended opportunities. So, for example, Capital Chemist Panayiaris is in Canberra, but we have a sister store. One of the other ones a partner with is in Braidwood, which is an hour away. So we have several of our pharmacists that practice 4 days a week or 3 days a week at Waniasa and live in Canberra, but they actually practice 2 days or 1 day a week out in the country. So they get a travel allowance, and we send them out there purely for their interest, really, because they're flexible, they're happy to do it, they love it. And it's just different atmosphere, different pace, often a more relaxed approach to just the general feel of the pharmacy. But at the same time, different skills and great opportunities to contribute. Sometimes, there aren't the same facilities available or the same breadth of services either. So it is a lot more challenging at times, in a good way, to help you think a bit more out of the box of how you can assist, but still having, city conveniences, I suppose, and those sorts of comforts too.
I think there's also a lot of opportunities out there in locuming at the moment. I've heard of many pharmacists who've travelled their way around Australia working in different pharmacies. I reckon sounds like a great gap year, not gap year, but a great working year. Nick, you touched briefly on mentoring and how important it is in pharmacy, but with everything being online, we're all looking through a Zoom screen still a lot of the time, even though it's at the end of it. It can be hard for students to kind of build these networks. What advice would you have for finding that mentor and building this network around you?
You're on mute, Nick.
I'm trying to keep the noise in the background here sometimes. So building the networks and those relationships. Yeah, look, I must admit, I do not envy the last couple of years, and I do a fair bit of work with the uni here. And I do think that the students of the last couple of years that are coming through are definitely going to be at a disadvantage from that point of view, and they're probably just got to work harder at it from that aspect. So look, everything from being involved in associations, groups, or whatever, where you can try and build those connections, both informally and formally, whichever it comes up. But sometimes it's really also just, as we said before, like the person who said, I can't get a job. You actually need to pick it up and look at those opportunities in terms of where can I get involved, right? What and if it's at a student level, I know obviously NAPSA do a great piece of work here in terms of obviously those connections and sharing those connections. And again, Georgia, we've had a lot of these conversations with NAPSA from that point of view, that connecting, whether it's guild officials or people like or even at the next level down, the branch committee level of the guild, but even owners, from that point of view, in terms of working groups and so forth, that you can try and you've really got to try and be as proactive, whether it is through your association or through any relationships, that you can foster and build from that point of view. There's always a willingness, no matter how busy we are, to try and at least have a conversation, right? May not be able to give you a lot of time, but happy to have a conversation, when you're trying to, and there's always, whether it's Elise, it's me or whatever, someone is always out there that's willing to partake knowledge to help from that point of view and support them. But a lot of it will be built up from within your work environment. So that's why I go back to the critical factor. You've generally got 2 or 3 pharmacists in many cases that you'll be working with in that environment. Get to know them, in professionally from that point of view, build those connections, and every workplace from thereafter, don't just assume it, I've left that workplace. Keep the number of the old owner, have a chat to them and say, look, do you mind if I give you a call now and then? If there's, whether it's a business opportunity or whether it's a professional piece of advice. So you've got to work on it.
Yeah, I think, and LinkedIn, add people that you like on LinkedIn. If you see them commenting on something, say, can I ask you some questions? I have a Facebook Messenger full of people that I will probably never meet that are asking, and I'm happy. And like Nick said, everyone's happy to help. I think the lovely thing about our profession is no one's ever shut a door on me. And I've asked some pretty important people some probably, on reflection, pretty trivial questions. And they always reply, they always listen, and no one ever has made me feel small or that I couldn't ask a question like that. The only stupid question is the one that you never ask. So just reach out. And in this virtual sort of warped time that we're in, more than ever, I think people expect to be approached in that way because we're not necessarily seeing each other face to face. So it's not as awkward. You sort of expect that the introduction, the handshake that you're going to get these days.
Yeah, and I think taking that first step to get involved, it is also a bit of, you can't sit back and wait for it to come to you. Like, I entered pharmacy and I was like, yeah, I'll sit here and be a typical pharmacy student. I enjoyed my local branch in my first year, then NAPSA and everything. And then we went and had drinks with the national president of the guild at different events. So just getting involved, you can meet so many people online. I think we had a conversation with Nick and I was like, oh my gosh, and everything. So they're all really friendly. They look really scary behind these screens, but I think we're getting to the end of this session. We've got a few more questions though. I'll read out the last couple of 2. In regards to health services in community pharmacy, how do you introduce and organise new services in the pharmacy, such as mental health and or sexual health education?
This is my thing. So you have to find, it's like, yeah. So you have to have a need or a demand or a gap. So I'm often looking for those. So, see where something's not being done as well as it could be, and then think of how you can make it better. Sometimes that can mean talking to some local health services, because sometimes you think there's a gap, but there's not actually. But in terms of, for example, mental health, so we were noticing in our community, and it's only just got worse and worse a number of years ago, that there just wasn't really that sort of face-to-face immediate connection, particularly when people were being prescribed antidepressants for the first time. And so we made a service at the pharmacy where we offered some sort of ongoing support, sort of specific information leaflets, and we had all those conversations, even just around going over the medicine with the person in a private consultation room. So they had the opportunity to let out what was really going on. We often found that when people were in the consultation room environment, and we do it very informally, it doesn't feel uncomfortable. We basically say, oh, is this a new medicine for you today? And they say, yes. Then you say, I'll just come over here and I'll print a leaflet. And the printer just so happens to be in our consultation room. And we just kind of have a sit down. Often those conversations haven't been able to be fully unraveled in the appointment with which led to that prescription being written. So it gives the person a chance to unravel it a bit more, sometimes process what's going on, and sometimes they're not ready. They're sort of, this is a big step, and they're trying to sort of put it all together. So we found that gap, and that gap continues and has only really got bigger through the pandemic. But I think new health services, sometimes there are already people out there that are doing what you're doing, and that's okay, but maybe no one in your area. So again, have a look at the industry, even just a quick Google search. If you typed in mental health pharmacy, and an area, I'm sure it would bring up like things that we've done and other pharmacies have done over the years. Then reach out to them and say, can you help me? And like I said, it's just that friendly collegiate vibe that will allow other pharmacists will be happy to chime in and give you any tips and tricks around that. But yeah, find your gap, find a way to help and to be supportive, and then obviously you need to tell people that you're doing it. There's no point if it's this secret squirrel offering. Share that with your local community, both the public but also the professional community, other health professionals, so that they know how the pharmacy can service the community in a better way.
Yeah, look, again, looking at, I guess, more rather than a shotgun approach, which pharmacy's been probably has done in the past, where they've said, oh, look, we'll put all of these services in, but haven't actually done, I guess, the assessment of whether those services, as Elise said, are actually necessary in that community is the first place. So, you've actually these days got to be a little bit more sophisticated in your approach from that point of view. So mapping, your local community in terms of which services are offered and which ones are not, in terms of just traditional type pharmacy services. One of the things that we did in our farms, first thing we did, compounding wasn't being offered, within a fairly big catchment area. So that was, and then we assessed, yes, there was demand both from the vets, doctors and everyone else basically that for those services. Looking at the ABS data around demographics is really, really important because you've got to understand what your demography is, as in who are your population group, are they elderly, young, whatever. That also tends to tell you what type of conditions are prevalent in your, so there's no point running an asthma service when there's no asthmatics or a very low percentage of asthmatics in your local community. So mapping the health conditions is the first place to sort of assess whether a service may be required based on health conditions. Local councils are really, really useful in terms of, because they quite often already know where the gaps are, based on, they try and fill bits and pieces in where they know the gaps are, but quite often you partner with them or offer them the opportunity. There's always, they identify health conditions. GPs and the types of practices that are in the area are really an easy way to, so one of the things we do is we offer a quite specialised service around IVF support and IVF medication, because we've got an IVF clinic close by, and from that service we've actually now picked up other non-related IVF practices that are not even near us, because of the type of service that we've actually implemented, including 24-hour access, a support service, the concierge, the whole lot. Local businesses, you'd be quite surprised at how do you partner with a local business from what you can deliver and bring to the equation. So we've got one of the biggest travel services right next door to us in terms of an agency. It's probably the biggest one in South Australia. So we've actually got a travel health service, which is quite extensive in terms of everything from packing medicines for travelling right through to first aid, right through to vaccination and bits and pieces like that. So we've partnered with them, and they literally put their fly in everyone's pack basically from that point of view in terms of things to think about before travelling. And in the same way, partnering with other health professionals. Sports injury is a real easy one in so many ways, where a lot of pharmacies don't get involved in, but actually you can play a really big role in terms of your sporting clubs, partnering with physios and so forth and so on. That's another low-hanging fruit sometimes. But you've got to get your team involved as well, to the point where actually you give them some ownership around who's got interests and passions in certain areas as well, once you identify what those opportunities are, because actually can do a lot of, not only a lot of the work for it, but actually really drive those areas of your practice as well.
It's kind of cool. You sort of are the master of your own destiny, in that you can tailor things, like whatever's of interest to you and your community, you can implement. And that's not just if you're an owner. That's, I've had community pharmacists who have a passion, who have also, implemented services many, many times. So it's that kind of, like you get to choose it. You're in charge. There's no standard formula. You can tailor it to look how you want it to look. And it can be as big and grand or as simplistic and, and intricate as you want it to be. So yeah, it's quite sort of empowering to know that you can really work out something and do it, and there's not going to be someone that says no, you can't, because everyone's just trying to help, and however that looks for your individual community, you get to decide that with the research that you do.
I demand and expect my employee pharmacists, basically from that point of view. I don't ask them, I expect it from them. And even the intern discussion I had the other day, I said to him in no uncertain terms, I expect you to look and provide and, you know, investigate and bring me an opportunity that we could look at, which we're currently not. And look, 99% of all owners will love that from that point of view in terms of that proactive approach. You actually, that's really showing initiative from that point of view, and in terms of identifying options. There's not too many owners that wouldn't gamble or take a chance on an opportunity, as long as you can bring it in a well-formed manner and you've thought about it and you've got some good information around it.
Yeah, and I think most internship programs now have a health promotion component where it's actually, you have to actually make a project in the community and implement that. So it's definitely becoming the forefront of our practice. I think we only have 5 minutes left. So I might finish off with one question that we get quite a lot as students everywhere. And I think you answered it in there, Elise, but it's around the difference between hospital and community pharmacy. And we're seeing a trend of students wanting to move into hospital pharmacy, and it's kind of deemed not the first outcome, but like, do you think the better graduates are moving into the profession, or is that a complete lie? Like, what is this trend that we're seeing?
I have amazing interns and pharmacists. I usually have 2 or 3 a year, and I have done since I've been an owner. None of them at the top of their class. I'm sure many of them would have, but at the same time, I'm sure many of them could have went into hospital pharmacy if they chose to. They are just amazing people. They love helping others. They're caring, they're nurturing, they're innovative, and they want to be in control of what the future looks like of healthcare in the setting that they practice in, which is our pharmacy. And it's clinical, and they are engaging with other areas of the health system, and they're respected and valuable. And yeah, I don't really see it as a 2-tier choice. There's just different options for people, and they'll value different things about the way they want to spend their days. But I actually have a couple of hospital pharmacists working with me now that there's been a lot of just change generally, people sort of wanting a different scenery, and they love it. They really enjoy it. They get to talk to lots of patients. Sometimes that's what is sacrificed when hospitals are really overwhelmed and busy. That ward time and those patient interactions are what, you know, is first to reduce. But that is fundamentally our everyday baseline, and they really enjoy the variety.
Yeah, look, my only comments, I use these because I get this question a lot. And it, as Elise said, this is not about, you know, them and us type scenario. It's really about where you want to choose to practice, basically, and the type of way you want to practice at the end of the day. That's really what it gets down to. And, you know, our information tonight is really just to give, I guess, students a better understanding of what we do in community pharmacy from that point of view. And look, I just use one example, which I always use on the basis of, I can see why people go into hospital pharmacy, absolutely, and I have a lot of good feedback from especially young pharmacists that I catch up with, a lot of them being family-based friends as well, and they love, you know, the learning aspect. They love all the detail aspects of what they do and so forth. I do ask them a really simple question though, in terms of, and I guess this is how you want to practice to some degree, that how I want to practice. I said, what happens when you make a clinical decision on that particular patient that's come into hospital? And yes, great, you might have made a great intervention and made a huge difference in terms of the stability of that patient's condition and so forth. But what happens 3 days later when they've left the hospital? How do you know what you've done is going to make a difference to that patient's longer term, not only condition, but their lives and so forth? Whereas the way we practice is I get to see that patient every month, and every intervention I make every month, whether it's just simply filling that prescription, but having that conversation, picking up bits and pieces of information that then might highlight another problem, which then I've made another intervention. And as Elise said early on, I've got people that basically, I remember their little kids coming in and now they're full grown adults basically from that point of view. And you've seen that whole journey of how you've helped manage that whole family's health along the way. So that's a choice of how you want to practice. If you want to practice acutely to some degree and you want to make those interventions, but not necessarily understand and know what difference I've made long term, that's a way of practicing, and I don't knock it from 1 minute. But if you really want to actually make a difference to your local community and people's health from that point of view, then practicing community pharmacy.
Yeah, and I know a lot of pharmacists who actually do both, so I don't think it's a matter of choosing one or the other. So, all right, guys, I think we're out of time on that. So thank you, Nick and Elise, for joining us today. It's been a great program, I think, and thank you to all you guys who've come along. All your questions kept us busy for the whole time. So if you guys have any other questions that weren't answered here today, please feel free to pass them along either through your local uni branch, local guild branch, getting in touch via the guild website, via the NAPSA website, any of these resources. And please join up to your local guild, join up to your local NAPSA. It's a great way to get involved. I believe we have one more event coming up in the program, which is our community pharmacy careers at 6:15 p.m. If I'm not correct, Annika.
Yep, that's right. So yep, session 3 of the student summit is at 6:15 p.m. AEST, community pharmacy careers. If you haven't registered yet, I've just chucked the registration link in the chat. And thank you so much for joining us all today, Nick, Elise, and Georgia. Some really great answers and insight. I think we've all learned a lot today, and some really great facilitating, Georgia. You did a fantastic job. Thank you so much.
Done a great job, Georgia. Well done.
Well done. Good job.
Thank you.
Yeah. Thank you so much. So thank you everyone for attending, and we'll see you in the next session.
Thank you all.
Thank you.